Your AFib did not start on the day you felt it. It started years before that, and your heart has been quietly building toward that moment the entire time. Forget caffeine, forget stress, and forget the surface level triggers you've already heard 100 times. If you've ever asked yourself, why me or why now, by the end of this video, you'll understand exactly why AFib develops the way it does and why that first episode felt sudden, even though it never was. Most patients think AFib comes out of nowhere. One random Tuesday, the heart just starts fluttering. That's not what happened. That episode was the final step of a process that was already years in the making, happening in tissue you can't feel and symptoms you never notice. Here's the myth I want to bust immediately. Forget the idea that AFib has one single cause, one trigger you can point to and blame. It doesn't work that way. AFib happens when two separate things collide on the same day. Think of it like a lightning strike and a dry brush. The lightning is the trigger, a single, small electrical spark. The dry brush is your atrial tissue, already vulnerable, already primed to catch fire. Lightning strikes healthy, wet forests all the time, and guess what? Nothing happens. It's the combination that creates the fire. The trigger almost always comes from a very specific location. Small muscle sleeves that extend from your upper heart chambers into the pulmonary veins, the vessels that bring blood back from your lungs. This was a landmark discovery in cardiology because it explained why ablation procedures target this exact area. And these particular cells are unusually excitable, and they can fire an early unwanted electrical signal, essentially a single skipped or extra beat. At the cellular level, this happens because calcium leaks out of storage inside your heart cells at the wrong moment, creating a tiny electrical current that fires a beat before it's supposed to happen. This is a completely normal thing your heart does occasionally. Everyone has an extra beat once in a while. But here's the critical part. In a healthy atrium, one extra beat is just one extra beat. It comes, it goes, nothing happens. The substrate is what changes that outcome entirely. If your atrial tissue has already become abnormal through scarring, thickening, or disrupted electrical connections between the cells, that same single extra beat doesn't just pass through, it gets trapped. It circles back on itself and spirals into the chaotic, self-sustaining pattern that we call AFib. Without the substrate, a trigger is nothing. Without a trigger, a substrate can sit quietly for years. AFib requires both to converge on the same day. So the real question becomes, where does that vulnerable substrate come from in the first place? This is where your other health conditions come into play, and it explains why AFib is so tightly linked with things like high blood pressure, obesity, sleep apnea, my favorite, and diabetes. Here's the mechanism. When your atria are chronically stretched from high blood pressure, from extra weight, from low oxygen during sleep apnea, that stretch activates a hormonal cascade in your body that causes scar tissue called fibrosis to build up in your heart's upper chambers. At the same time, oxidative stress and low-grade inflammation inside your heart cells disrupt the electrical wiring between them, making it easier for chaotic signals to spread instead of dying out normally. This process is happening silently, with no symptoms at all, often for years before that first noticeable episode. In fact, researchers have found inflammation and scarring on heart tissue biopsies, even in patients having their very first AFib episode. With no previously known heart disease, the substrate was already there. It just hadn't met its trigger yet. This is exactly why managing blood pressure, weight, and sleep apnea isn't just generic health advice. It is directly addressing the biological process that builds the vulnerable tissue in the first place. Let me answer the two questions I know you're asking right now. Why did my AFib start on this specific day and not some other day? And about 1 in 5 newly diagnosed cases, there's an identifiable trigger for that specific day, commonly something like an infection like pneumonia, a recent surgery, a heart attack, or heavy alcohol intake. These acute stresses shift your heart's electrical balance just enough to let a trigger take hold. But here's an important, honest answer. In the majority of cases, no specific trigger is ever found. The extra beat that started it was all essentially random. Your substrate was ready, and eventually, statistically, a trigger was always going to come along. This isn't something you did wrong, it's how probability works once the underlying tissue is vulnerable. Once I've had AFib, does it progressively worsen? And often, yes. But understanding why is empowering rather than scary. There's a real phenomenon researchers call AFib begets AFib. Each episode itself causes some electrical remodeling in your heart tissue, which makes the next episode slightly more likely. This is the mechanistic reason AFib can progress over time from occasional brief episodes to longer, more persistent patterns as scarring becomes more extensive. This is exactly why early treatment matters so much. Addressing your AFib and its underlying risk factors early isn't just about comfort today, it's about interrupting that progression before the substrate becomes extensive enough to sustain itself without needing a trigger at all. And if you want to download an approachable plan that we created for you, and it takes less than 2 minutes, go to fightafib.com and go ahead and download it. You can take action immediately, and these are actionable things to leave you feeling more prepared as you walk into your next doctor's appointment. Your AFib is not bad luck, and it's not a mystery. It's the result of a real, understandable biological process, years of silent tissue changes meeting one small, often random electrical spark. Understanding this doesn't just satisfy curiosity, it tells you exactly where your leverage is, the substrate. That's the part you can actually influence through blood pressure control, weight management, and treating sleep apnea and reducing alcohol.